Hello everyone, nutritional scientist Liam McCauley here again. Today I have a very interesting video for you, and I've done quite a bit of research for this video, and this video will be on treating acne with nutrition. Acne is a skin condition that affects many people globally, regardless of your age. While some may only present with acne during adolescence, it is nonetheless a condition that can affect people of all ages. Of recent, there has been a massive global rise in skincare products and trends. Many individuals are looking for a quick fix to what is a complicated condition, extremely complicated. In this video, I aim to discuss the essential role that proper and personalized nutrition and supplementation can play in the treatment of acne. I hope to present an alternative approach to those who might be struggling with treatment-resistant acne. It is most certainly no secret that nutrition can have a considerable impact on our ability to maintain homeostasis or proper health. Our skin is no exception to this, really. So consuming a diet that is both nutrient-rich and balanced can assist in the maintenance and improvement of our skin health. Supporting our skin health through proper nutrition will ultimately reduce the likelihood of having acne breakouts. An example of a nutritional intervention that can assist with acne is the low glycemic diet. Studies such as the one displayed on your screen have shown that high glycemic foods such as processed carbohydrates and refined sugars can lead to the development of acne. The mechanism by which a low glycemic diet is able to reduce acne is by helping to regulate blood sugar levels, reducing spikes in insulin, and reducing inflammation. Consuming a diet rich in omega-3 fatty acids, such as fish, seeds, and nuts, can also help to manage acne. This research article here shows us that supplementing with fish oil can reduce the severity of moderate to severe acne. I also encourage those with acne to consume a diet high in antioxidant-rich foods. Antioxidants such as vitamin A, C, and E are essential in helping protect our skin from the continuous damage done by oxidative stress and free radicals, both of which can contribute to the development of acne. Foods that are high in antioxidants include vegetables, fruits, and whole grains. Now, so far, this has sort of all been quite elementary advice that you could find and source anywhere on the internet. So now I would like to discuss a few niche supplements that can be used for the treatment of acne. The first supplement I want to discuss is probiotics, which can be used for many things, but are very effective for treating acne. So gut health plays an essential role in the health of our skin. And research such as the one I've pulled up for you on your screen strongly suggests that imbalances in our gut microbiota, known as dysbiosis, dys meaning bad and biosis meaning life, essentially, so the condition of bad life, can lead to acne. Supplementing with a probiotic can help reduce acne by promoting a healthy balance of gut bacteria, which in turn can improve the health of your skin and reduce acne breakouts. Let me just pull up another article. So another supplement that can be used to treat acne is pantothenic acid, more commonly known as vitamin B5. So pantothenic acid plays a crucial role in the body regulating the production of oil in the skin. So you can imagine its effect on acne. So pantothenic acid is able to help in the breakdown of excessive oils produced by the skin. These oils can clog pores, which results in acne, essentially. Additionally, vitamin B5 helps with the operation of the adrenal glands. The adrenal glands are responsible for releasing many of the hormones that help regulate the production of the skin's oil. The study I pulled up essentially concludes that pantothenic acid is a safe, well-tolerated, and effective intervention for the treatment of acne. The last supplement I want to discuss, and I've left to last because of the potential consequences of misuse, is vitamin A. Vitamin A is one of the many essential nutrients that plays a critical role in ensuring our skin is healthy. Typically used to treat acne as a topical, as a topical product that you apply to your skin, as retinol, it can also be used as an oral supplement, and that's what I want to discuss in this video. There are several studies here I want to look at just to inform you a little bit about vitamin A's efficacy in treating acne. Now, before I look at these studies, I do want to disclose that prolonged use of high dosage vitamin A supplementation can result in bone problems, birth defects, and liver damage. So please don't come to me with jaundice complaining that I have given you incorrect advice. I'm not necessarily encouraging the use of vitamin A. I'm just saying it can be beneficial under certain scenarios. So let's look at a bit of the research here. I'll just pull it all up. So, in this article titled Oral Vitamin A for Acne Management, a possible substitute for isotretinoin. So, isotretinoin, also known as Accutane, is a very common treatment for acne. It's usually a last resort because it is quite a dangerous sort of medication to be using. All right, so in the conclusion of this study, it says oral vitamin A could potentially serve as a substitute for isotretinoin, that Accutane that I just mentioned earlier, in acne management for select patients. Not all patients, select patients. However, due to concerns regarding toxicity and long half-life, strict monitoring under the care of a medical provider is prudent. Okay, I'm a nutritional scientist. My bachelor is in nutrition. I'm not a medical professional per se, so maybe take a little bit of what I'm saying with a grain of salt, but just something to consider. So, since vitamin A is available without a prescription, strict monitoring cannot be assured. Okay, you can get it over the counter, pretty much any pharmacy. And especially careful patient selection and education would be essential. That's what I hope this video is, slightly educational. Okay, so let me pull up another article here. Okay, so this article titled Optimal Dosage and Per Oral Therapy of Acne with Vitamin A Palmitate. This article was done in 1976 for some context. I don't even think science existed back then, so be a little careful reading these results. Okay, so there's no risk of liver impairment when 150,000 to 200,000 international units are given daily over extended periods. Doses over 300,000 international units are accompanied with liver impairment. Okay, so you can get those sort of liver damage from the high vitamin A doses. Keep in mind, all of these doses that it's discussing here are massive. Okay, so during long-term treatment, tests should be performed regularly. Okay, get regular blood tests. Contraceptive advices are recommended just because of the potential for birth defects. Okay, so this is sort of saying, be careful with those bigger doses. I just wanted to put that in there for some context. Okay, so this article here, in its discussion, and I recommend you read this whole article, it's very interesting. This study of the treatment of a patient with recalcitrant nodular acne, also known as cystic acne, demonstrates that vitamin A is a highly effective treatment and an inexpensive one as well. Just something to consider, something to look into. All right, last article here. So, oral vitamin A in acne vulgaris preliminary report. Once again, this study was done in 1981. Apparently, no one studied vitamin A in the last 50 years, so that's a bit unfortunate. But okay, so oral vitamin A, retinol, as it's more commonly known, is generally not considered useful in the treatment of acne vulgaris. Oh, that's a bit concerning, isn't it? Let's read on. We conducted a study which showed that retinol was indeed ineffective at the usual doses of 50,000 to 100,000 international units daily. Okay, so what else has it got to say? Something a bit more interesting here. Retinol was highly efficacious in doses of 300,000 units for women and 400,000 to 500,000 units for men. Toxicity was slight and limited mainly to skin and mucous membranes. Okay, interesting. So it's sort of disagreeing with that other article earlier, saying taking over 300,000 units isn't as dangerous as you think. Keep in mind, this is just one study. So it's saying the danger of hypervitaminosis A, okay, so increased levels of vitamin A or vitamin A toxicity, in the dosage range has been exaggerated in this article's opinion, in these authors' opinions. So retinol is a valuable drug for treating stubborn, severely inflammatory acne vulgaris. Interesting. It is administered until the disease is brought under control, usually within 3 to 4 months. Okay, so it's sort of saying you don't really want to go much longer than that. Then the dosage is progressively reduced, relying on conventional drugs to keep the disease, at bay, essentially. Okay, so another little interesting thing to read. Like I say, all these articles will be linked. Some very interesting stuff. Okay, but that's basically all for this video. This brings an end to this video on using nutrition to treat acne. I hope this video was of use to you, and I've linked all the articles in the description of this video. I strongly encourage you to read them. I'll see you in the next video. Thank you.